Hello everyone, Young here. This is my midterm project regarding the healthcare services in the United States. Is the healthcare getting more expensive than ever before? Now, before we jump into the spreadsheet, I would like to talk about why I chose this topic. A lot of times I've heard about some insane medical bills in America, and quite a few friends of mine who study or live in America told me that, receiving healthcare services in the United States is a lot more expensive than anywhere else. Well, I'm from China, where the healthcare system is relatively cheaper, but still in the preliminary phase of growing. So when I start my studying here, I'm eager to find out, is it really true that healthcare in America is expensive? So here's the background information about this topic. Healthcare in the United States is actually about twice as expensive as it is in any other developed country. The cost of this huge financial burden for every household because of lost wages, higher premiums, taxes, and additional out-of-pocket expenses is more than $8,000. Even with all this money being spent on healthcare, the World Health Organization ranked the U.S. 37 in healthcare systems. So how expensive the healthcare actually is? And is the rather expensive healthcare system actually benefiting American people accordingly? Now let's get started. So basically, I retrieved my data from these two websites. The first one is the CMS.gov Centers for Medicare and Medicaid Services, and the second one is the WHO website, of course, the American sector. As you can see from here, we got a bunch of indicators done by the WHO. We've got data from socioeconomics, health status, service coverage, demographics as well. The reason why I include socioeconomics because there's actually a correlation between the healthcare cost and the socioeconomics factors, which I will be touching on later. And as for the CMS data, we've got total healthcare as percent of GDP, and also total outpayers per capita. Well, for some reasons, I cannot retrieve the latest data from the year 2018 because the newest one I could possibly get is from the year 2014. But it doesn't really matter that much because what we're trying to do here is just trying to predict a trend and interpret the changes. So as you can see from this data set, it's actually very the data is quite this bunch of data. It's not very straightforward. So what I do here, I include some spark lines in here. Not surprisingly, all of the states has been experiencing an increase in healthcare cost from the year 1991 to 2014. That's almost 20 years. And I also want to make this chart even more straightforward, so I use conditional formatting here. So if you want to see the top 10, make it red, and the last 10, make it green. Yep, as you can see here. So the top 10 costs are actually concentrated on the northeast part of the United States, where there are a lot of big cities, and urbanization is another important factor in determining the cost of healthcare. So as for the dashboard, we actually have 4 pivot chart in here. The first one is about socioeconomics indicators. As you can see from this chart, the blue line is the annual GDP growth rate. It's actually doing pretty well. And especially after the financial crisis in the year 2008, and the gross national income is increasing at a steady basis, which, in other words, people are getting richer and people are benefiting from the economic growth. And as for the second pivot chart, that's the healthcare expenditure versus population growth rate. So the orange line is the national health expenditure as percent of GDP, and the blue line is the annual population growth rate. So as you can see from this chart, there is actually a spread between the two lines, and the line is getting even larger, which indicates that a better expenditure per capita in terms of healthcare funding. In other words, the government has spent a lot more on healthcare than ever before. Even though the shrinking of population growth rate might not be a good thing in the long run, but that's not a main topic here. And the third pivot chart illustrates the healthcare cost per capita by state. So basically, our first impression about this chart is that, and of course this is slides in here, you can choose whatever state you want to look on. So basically, the impression we get from this chart is that, well, within, of course, the blue bar is the data from the year 1994, and the orange one is from the year 2014. That's almost 20 years. So within 20 years, the cost has more than doubled. However, the gross national income, well, discussed before, somehow, well, is somewhat less than doubled. That explains to some extent that people get a feeling that healthcare cost is getting very expensive right now. And as for the fourth chart, it's the personal healthcare cost by region. So basically, I divided America into these regions, and of course, I specifically point out New York and United States as a whole. As you can see from this chart, well, personal healthcare cost actually takes up the most proportion out of the total healthcare, and this factor is likely to be affected by the urbanization of a certain area. So in this chart, we can see that in areas where there are a lot of big cities, say New York or New England, the personal healthcare cost is actually higher than the one in some sort of remote areas. This might be due to the reason that people in the big city tend to be more concerned about health, and also in big cities the healthcare cost is just relatively higher. Now let's get into the power wheel. Well, I'm sorry about this map because this is the Chinese version of Excel, so the Bing map doesn't work in here, but I'm pretty sure this will work on an American version of Excel. So in general, the East Coast bubble, as you can see from this bubble layout, the East Coast bubble layout shows a higher healthcare cost per capita than the West due to several factors, including higher population density, relatively higher class level, and a higher urbanization level. But on average, the healthcare cost per capita is just evenly distributed among all the states. And the second power view is about the life expectancy and the healthcare expenditure. Well, what I'm trying to do here is I'm trying to illustrate the correlation between the life expectancy, the result of such a high healthcare cost, and the money we actually put into the system. So as you can see from the scatter plot, I make it a dynamic scatter plot. So the life expectancy is actually increasing year by year from 76 years to almost 80 years at the end of 2018. While even though we have spent a little bit higher, we have spent a bit more money than before in terms of healthcare expenditure, but it's still not that much, still under 20%, and it's still under control, which means that the result is actually pretty good. So the outcome of this project, let's say, is that even though the expensive healthcare system is somehow, well, maybe a little bit, expensive to some people, but it is also in line with a higher quality of medical services and a longer life expectancy. During my research, I think political reasons also play an important role in determining the healthcare cost. So far in the United States, there has been a lack of political support for the government taking a larger role in controlling healthcare costs. So that's a big reason why healthcare costs is getting skyrocketing. Now, at the end of my project, as a finance major student, this is my first time doing such a project. My Excel skill improved a lot from putting what I've learned in class into real data analysis. And I do appreciate the chance I do appreciate this chance to sharpening my Excel skill. Anyway, thank you very much for your attention.